I offer my humble pranams at the lotus feet of our beloved Bhagwan Sri Sathya Sai Baba. Sai Ram to all. Thank you for joining us for today's healthcare webinar on the story of vaccination. Today's facilitator is Dr. Sharavanan Jeyanathan. He is a GP partner and GP tutor in Southeast London, New Cross. He has a keen interest in medical education and medical school and GP registrar levels. He is the former president of Bromley Science Centre and is currently Region 1 Healthcare Lead Representative. He has a passion for music, singing and playing a variety of musical instruments and has had the golden opportunity to sing and perform in the design presence of our beloved Bhagwan as part of the Sai Mahima pilgrimages. In this webinar, Dr. Jeyanathan will be looking at the story of vaccination and the reason for vaccine hesitancy for preventable infectious diseases in the UK. I pray today's webinar will be of help. Please keep safe and look after yourself. I now hand over to Dr. Sharavanan Jeyanathan. Jai Sai Ram.
My humble pranams at the lotus feet of our beloved Bhagwan Sri Sathya Sai Baba. Sai elders, brothers and sisters. Jai Sai Ram. Today I wanted to talk to you about the story and origins of vaccination. This is a dark story of a deadly and disfiguring disease that has stalked humans through history over the last 3,000 years, killing up to 300 million people in the 20th century alone, indiscriminately bringing down the poor, the destitute, and children, as well as bringing down empires and disfiguring and killing kings and queens. The end of this story is one of hope, a story of discovery, of doubt, of anxiety, of uncertainty, of fear of a new technology, and of how, ultimately, the human species came together through a gargantuan effort to become, to date, the only disease to affect humans to be wiped out entirely. That disease is smallpox. Its eradication stands as the greatest public health triumph in history and should be regarded as incredible a scientific achievement as putting a man on the moon. I have been asked, why would I want to talk about this topic? And there are several reasons. One of my roles as a primary care physician is in disease prevention, and part of this comes down to health promotion and health education. Far before the current COVID-19 pandemic, I have sadly seen a subtly yet steady rise in general anti-vaccination sentiment and vaccine hesitancy in my day-to-day work as a family doctor and general practitioner. And I am not the only one who has spotted this general and worrying trend. This was something that was recognized by the World Health Organization in 2019, when they listed the 10 threats to global health in 2019 that included things like air pollution and climate change, non-communicable diseases like diabetes, cancer, and heart disease, antimicrobial and antibiotic resistance. Probably their most prophetic of their documented concerns was that of a global pandemic, and sadly how true that came to be as the year of 2020 progressed. Now you will note that they specifically were concerned about an influenza pandemic, and the WHO has their influenza virus monitoring services, ever vigilant, monitoring the evolution of flu viruses and their movement across the globe. This helps inform countries across the world as to which strains they should be using to design the next seasonal influenza vaccine. I still remember being a first-year medical student, all the way back in 2003, when my virology lecturer, Professor John Oxford, held all of us students spellbound, teaching us about the devastating impact of the Spanish influenza pandemic of 1918, which killed around 50 million people. I remember him stating that we were overdue our next pandemic. And really, his words at the time seemed fanciful, for dramatic effect, and that of science fiction. What the last year has sadly taught us is that this was not science fiction. This was science fact. And the WHO also had on their list of top 10 threats to global health in 2019, vaccine hesitancy. The reluctance or refusal to vaccinate despite the availability of vaccines threatens to reverse progress made in tackling vaccine-preventable diseases. Vaccination is one of the most cost-effective ways of avoiding disease. It currently prevents 2 to 3 million deaths a year, and a further 1.5 million could be avoided if global coverage of vaccinations improved. Now, before I go through some of the reasons laying behind this global health concern, I should stress that this talk was targeted at talking about the core NHS vaccination schedule and not about the current COVID-19 vaccination program. Indeed, this was a talk that I had an idea to do all the way back in 2018-19 because of my growing concern on the ground. When you do go to the NHS website regarding the vaccination schedule, they will, of course, prominently talk about the COVID-19 vaccination program. But in 2019, when the WHO were talking about the 10 threats to global health, they were really talking about the core vaccinations that are given in childhood for conditions like measles, mumps, rubella, diphtheria, polio, Haemophilus influenza type B, meningitis, and rotavirus, as well as those for adults in later life. You can see the range of vaccinations that are recommended on the NHS vaccination schedule, and you can see that each of these vaccinations has their own link and explanation as to what they are and what they are protecting against and why we vaccinate against them. You could spend a whole webinar discussing one of these nasty conditions, to which we now have disease-preventing vaccinations against, which really goes beyond the remit of the talk today. For those who are interested, I would encourage you to read through the resources on the NHS website. I do not need to remind you that the NHS is a world-respected institution in healthcare delivery that we know and trust, and in many ways is the envy of the world. So much so that back in 2012, when the Olympics came to London, we celebrated it in our opening ceremony. Now, going back to the schedule, I am going to pick out my top 3 favorite vaccinations from the list. And yes, that list does exist. In number 3, I would choose the childhood vaccination of HPV because of its potential to wipe out the majority of cases of cervical cancers during my career, which I just think is an incredible thing. Number 2 is the meningitis B vaccination, which was only introduced in 2015. I still remember when I was a junior doctor on my pediatrics rotation, taking care of a child around the same age as my daughter is now, about 3 years of age, just ravaged with meningococcal septicemia, profoundly unwell. And to think that we have a vaccine to protect against that disease is just incredible. And my number 1 position goes to the polio vaccine. The reason I say this is because this could be condition number 2 that is wiped out by vaccination following smallpox. One thing I would say is that the vaccination schedule does not only refer to childhood vaccinations, but also to adults as well. The one-off pneumococcal vaccine once you are 65 years and older, the annual flu vaccine, and the shingles vaccine for those patients in their 70s. Shingles is a particularly unpleasant condition that can affect the more fragile immune systems of more elderly patients, causing a painful, blistering rash. And this can lead to lifelong nerve-related damage from this condition known as post-hepatic neuralgia. And pregnant women. It has been shown that rates of low birth weight, prematurity, or even stillbirth can be reduced if pregnant patients are vaccinated against something as simple as flu. So you can see that the core vaccination schedule and how valuable it is. Coming back to vaccine hesitancy, there are a number of reasons for this. There is problems with inconvenience accessing vaccines, mainly an issue affecting the third world and poorer countries, and for those countries where sadly war is ripping them apart, countries including Yemen, Syria, and Sudan. There is a lack of confidence in vaccination in some parts of the community, and it's unclear where this is originating from, though I do think it does link into the third reason, and that is complacency. I can state that being born and brought up in this country, trained in this country, and now working here, that I have never seen a live case of measles, mumps, rubella, polio, or a Haemophilus influenza type B. In many ways, the vaccination schedule is a victim of its own success. Childhood mortality is an unpleasant and tragic reality that happens, but is thankfully rare in this country. And one of the reasons behind that is the success of the core NHS vaccination schedule to date. The conditions they protect against are horror stories that I have read about and studied in medical textbooks and not seen in real life. However, I do fear that with current trends, that some of these conditions could start to break out again, with reports of outbreaks of measles in different parts of the country over the last few years. Back in August 2019, the UK lost its measles-free status that was achieved 3 years after it was eliminated in the country. When facing the challenges of the present, it is important that we look to the past, not only to learn from the mistakes made, but also from where we have succeeded. Finally, it is a wonderful story of hope, of what can happen, of what is possible when the different peoples of this planet, of its many colors, of its many races, of its many political ideologies, what can happen when they join forces to conquer a common enemy? So what is smallpox? It is an ancient disease caused by the variola virus. Early symptoms may put you in a sense of false security. It includes high fever and fatigue. The virus then produces a characteristic rash, particularly on the face, the arms, and the legs, and the resulting spots become filled with clear fluid and pus, and they form a crust which eventually dries up and falls off. Smallpox was fatal in up to 30% of cases. It has existed for at least 3,000 years and was one of the world's most feared diseases. The virus which causes smallpox is contagious and spreads through person-to-person contact through saliva droplets in an infected person's breath. There was and is no known cure for smallpox. So let's think about smallpox through history. It's thought to have originated in Egypt about 3,000 years ago. The earliest evidence for the disease comes from the Egyptian pharaoh Ramses V, who died in 1157 BC. His mummified remains show telltale pockmarks on his skin. As I have said, smallpox kills in 30% of cases, but life is not so easy for those spared death by the disease. Survivors would generally have deep pock scars across their bodies and face, left disfigured, and in some cases, even blinded. In 1562, Queen Elizabeth I was struck down by smallpox at the age of 29. It was feared at one stage that she would die from the disease. She survived, but was left with scars across her face. She took to wearing heavy white makeup made up of vinegar and lead regularly to cover up her scars. Portraits from this time don't show any of the pockmarks, but certainly look to show this clean canvas of pure white skin, due to the makeup that she was wearing at that time. The disease later spread along trade routes in Asia, Africa, and Europe, eventually reaching the Americas in the 1500s. Indigenous peoples there had no natural immunity, and it was, put simply, devastating. An estimated 90% of indigenous casualties during European colonization were caused by disease rather than military conquest. Smallpox contributed to the decline of the Aztec Empire in what is now Mexico, following the virus's arrival with Spanish conquerors in 1519. More than 3 million Aztecs succumbed to the disease. Severely weakened, the Aztec Empire were easily defeated. Likewise, smallpox claimed the life of an Inca empire and wiped out much of the Inca population in Western South America. So where did the first defense against this disease come from? And that came from variolation. Now, in this lovely picture, you can see this patient having crushed smallpox scabs powdered and blown into the nostrils of patients. The earliest record of this process was said to have taken place in the Far East by Buddhist monks. You should be reassured that I have no such instrument currently in my general practice consulting room today. Born in 1749, a young 13-year-old English boy called Edward Jenner made an important observation growing up, and that was that those people who caught cowpox whilst working with cows did not go on to catch smallpox. In 1796, the now Dr. Edward Jenner was presented with a patient, a local milkmaid called Sarah Nelms, who sought treatment for cowpox that she had contracted. Now, I don't think that there was an ethics committee back then, because what Dr. Jenner did was to take this opportunity to inoculate a young 8-year-old boy, James Phipps, the son of his gardener, with material taken from the cowpox lesions of Sarah Nelms. After a mild fever and a few local lesions, the boy recovered. Jenner then tried to inoculate the young boy with material from a case of smallpox. Nothing happened. The boy was immune to smallpox. Over the decades that followed, Dr. Edward Jenner personally spread his message and technique of vaccination right up till his death in 1823. It seems that as long as there has been vaccination, there has been an anti-vaccination sentiment. with fear over the new technique creating caricatures like this one, where supposedly those inoculated with the new treatment were having cows growing from their arms and from their bodies. Jenner, however, remained optimistic, stating that, "I hope that someday the practice of producing cowpox in human beings will spread over the world. When that day comes, there will be no more smallpox." A visionary of his time, looking far into the future. If we fast forwards to the 1950s, vaccination programs for smallpox had more or less removed the threat of the disease from Europe and North America, with the three main areas remaining in South America, parts of Africa, and India, a disease that was still killing around 2 million people a year. In 1958, at the height of the Cold War, the USSR, led by the Deputy Minister of Health for the Soviet Union, Viktor Zhdanov, called on the World Health Assembly to undertake a global initiative to eradicate smallpox. The World Health Organization, only 10 years old at that time, took on the challenge, but did not really envisage that it was destined for success. And this was because of the many challenges that lay before them. Poor health infrastructure in the countries affected, war-torn countries, a lack of staff on the ground to deliver the vaccine and the education required, as well as to do contact tracing, and a pure lack of vaccine to cover the entirety of the populations of the hotspot countries. At this time, the Soviet Union cooperated with the United States of America to eradicate this disease. Ideologies and politics were set aside and the world united to fight this common threat. Dedicated public health workers across the continents went from village to village to identify outbreaks and attempt to contain it by vaccinating the contacts of those infected with the few doses of vaccines they had, a strategy now known as ring vaccination. Tireless contact tracing, health education, health worker training, and vaccination continued for several years. This proved to be very effective at not only controlling the spread of the disease, but also in ensuring the effective and efficient use of small amounts of available vaccine. Now I'm about to share with you an iconic photograph of two boys who contracted the disease back in 1901. One was vaccinated against smallpox and the other one hadn't. The boys were said to be classmates. Now I should warn you that the picture is quite graphic, and those of you who are of a nervous disposition should look away now, and I will let you know when I have moved on to the final slide. I am moving to that picture right now. This famous picture was taken by Dr. Alan Warner at the Leicester Isolation Hospital. Dr. Warner believed that the best way to challenge fears and misinformation about vaccination was to show the people the horrors of a disease and the clear evidence of vaccination at work. If you did turn away, you can now open your eyes and look back at the screen. The last case of infection of naturally occurring smallpox was in Bangladesh in 1975. The World Health Assembly endorsed data confirming the eradication of smallpox on the 8th of May, 1980. The first two sentences of the resolution reads thus: having considered the development and results of the global program on smallpox eradication initiated by the WHO in 1958 and intensified since 1967, we solemnly declare that the world and its people have won freedom from smallpox, which was a most devastating disease, sweeping in epidemic form through many countries since earliest time, leaving death, blindness, and disfigurement in its wake, and which only a decade ago was rampant in Africa, Asia, and South America. I will leave you with the words of medical historian Dr. Lindsay Fitzharris, who says that this was an unprecedented event in history, signaling the first and only annihilation of a human disease. It has since been hailed the single greatest humanitarian achievement of all time.
Sairam, thank you so much for such an insightful talk. And it's actually incredibly inspirational. What really hit me was just the vastness in terms of numbers. You know, the fact that vaccinations since the 18th century have saved millions of people's lives. And actually, I just was Googling the statistic, and it's 2 to 3 million patients a year have been saved. So again, thank you so much. And we're going to move on now to the Q&A. Should anybody have any questions, you can post on the YouTube link live, and we'll be sure to try to get through most of those questions. So Dr. Sharavanan, the first question that's come in are vaccinations mandatory?
So I would say at the moment, I mean, it's very important to say that at present they are not mandatory. I would say that in various different parts of the world, when you do sort of look across the world, I think in places like Australia, in places like Italy, I think especially, they have noted sort of worrying sort of drops in vaccination rates. And I think that there are, legislation being brought in place in countries to try and encourage vaccination to ensure the safety, especially when it comes to children. For sort of childhood vaccinations, but vaccination is not a mandatory requirement as things stand.
Okay, and there are, I guess, occupational reasons or travel reasons. Say, for example, traveling to Hajj, etc., where vaccinations might be mandatory. Do you mind expanding?
Yeah. So I mean, I would say that certainly, I remember when I was joining medical school. That there was a mandatory requirement for me to produce both a negative HIV test result as well as proof of vaccination for hepatitis B, as well as not only to show that I'd had the vaccination, but I had a blood test proving that I had antibodies to hepatitis B. I would also say that there are other, for example, there are certain parts of the world where you require, it is a mandatory requirement to provide evidence of having a yellow fever vaccination, which is quite a normal thing. And I think, from a religious, spiritual perspective, for the Hajj pilgrimage, which is held, Muslims, the Muslim family from across the world, they come and they descend on Mecca. And potentially, different Muslims coming from different parts of the world with various standards of healthcare, from different countries with various standards of healthcare. It could be a potential public health disaster if any of these diseases were allowed to spread. And I think it is a wise sort of mandatory requirement that if you're attending for the Hajj, that you need to be able to provide proof of vaccination for some of the core vaccination routes, and that's a standard thing that you can that is required.
Yeah, I suppose it's almost a public safety issue, isn't it?
Absolutely.
So what would you say to maybe parents who are a bit reluctant to immunize their children?
I think that any conversation, because this, as I say, for me, from my point of view, I would say, unfortunately, it is a discussion that I'm having more and more frequently. I always start that conversation by saying, whether it's a patient or whether it's a parent, I will say that, this body belongs to you, and you decide what happens to it. Your child's life is in your hands, and you decide what happens to it. And I think it's extremely important that patients feel empowered, to really be in charge of their health. And I think that stands whether we're talking about vaccination or whether we're talking about anything else at all. So I always make it important and make sure that patients understand that they're not being forced or pressured. But I think it is about trying to unlock the conversation of, what are your concerns? What are your fears? What are your worries? I certainly remember, taking my little ones for vaccinations and just looking at these sort of poor, innocent little creatures who we are then sort of jabbing repeatedly in their thighs. My heart sort of bleeds when my little ones are crying in my hands, that we're inflicting it. But at the same time, it's the responsibility that I take as a parent to do that. And certainly, as a clinician, when I'm teaching my junior doctors and medical students, I say, look, the care that you give for yourself, for your family, for your children, for your mother, for your father, that's the care, that's the level of care that you should be giving, to your patients as well. And I really do try and have, a heart-to-heart sort of honest conversation with parents. And I think that one of the things I will say, I practice in Southeast London. We live in a quite multicultural, sort of diverse part of London. I will say that we live in a global village. I think one of the comparisons that I sort of looked at was just how, smallpox took a long time for it to sort of move and travel and appear in different parts of the world, whereas we can see, within a course not of years or decades or centuries or millennia, but over the course of, a few weeks and a few months, how quickly something like COVID-19 was spreading. We really do live in a global village now, and we do, pre-pandemic, we had the privilege and the luxury of being able to travel to all four corners of the world to be able to see what wonders it has to show us and to offer us. But it does mean that actually, in more westernized countries where vaccination programs are still standing, even though there is some fragilities being shown to that. Actually, when we travel to other parts of the world where vaccination rates are significantly lower, mostly due to poorer healthcare systems and poorer infrastructure, we really do run the risk of picking up conditions and diseases, when we are traveling abroad. So it is something to be sort of mindful and aware of, that whether we're, thinking that we're safe in this country or, when we travel, it's something that we need to be sort of careful and cautious about.
Perfect, thank you. And we've just had a question that's come in to say, are there any unsafe immunizations?
Are there any unsafe immunizations? I sometimes describe some vaccinations as being more angry than others. Certainly, I know there are instances where we may avoid some vaccinations in some situations. So if I have patients who are immunosuppressed for whatever reason, then it's probably a good idea to sort of avoid some vaccinations. So I know that some patients on certain immunosuppressive drugs, so those are drugs which actually dampen the immune response, we would actually avoid some live vaccinations. So that's true of things like yellow fever vaccination. I think that if there is instead of providing a certificate to say that this patient has got a yellow fever vaccination, from yellow fever vaccination centres, it's not offered everywhere, but at the vaccination centres, if they can confirm that you are on drugs like that, then they can provide a letter to say that actually it's unsafe, for that particular vaccine to be provided. And so I do sometimes describe some vaccines as angry, and certainly unless we've got a good reason to give it, we try not to give it. And I'm probably talking beyond the core vaccination schedule here. So I think that, things like a rabies vaccine, I've heard, it's not a pleasant thing, which is why we try and sort of avoid the main source, which is sort of dog bites and cat bites and things abroad, to try and stay away.
Okay, perfect. And can you mention perhaps any good resources that perhaps people can refer to for a little bit more information?
So, I mean, I do really stress that we are profoundly, lucky, that we have an NHS and that we have, this institution which is, world respected. I would say, information about the core immunizations can be found on the NHS website. But I would also say the Fit for Travel website, which is also an NHS resource, sort of more broadly provides with regards to travel vaccinations and things of that description. And so, anecdotally, I will say that I do challenge some of my patients who are coming to me pre-pandemic, for travel vaccinations. And I would challenge them on, some of these diseases, you're traveling to a country, where these diseases are, and you're wanting to protect yourself from cholera and typhoid and things. But some of these diseases are actually on our doorstep, things like flu and pneumococcal and things. I'm like, but these are here, so we should be protecting ourselves. And the rationale behind protecting ourselves going abroad stands just as true as protecting ourselves against the diseases on our doorstep.
Okay. Somebody's mentioned that are vaccinations purely to protect us or to protect other people?
So I think it's a very good question. I think it's a really, really good question. For example, that I would probably say that there's a little bit of both. I think that statistically speaking, if we take something like the flu vaccination, for instance, we are living through a pandemic at the moment, but actually every single year we have a seasonal influenza epidemic. And every single year, if we think of, the terminology to describe the COVID pandemic, every single year there are a number of influenza infections. Every single year there are a number of influenza-related hospital admissions, and every single year there are a number of preventable, influenza-related deaths as well. I think it's a question of saying that, the majority of those complicated cases and deaths will be in patients who have got pre-existing medical conditions. But actually there will still be, a number of sort of younger, fitter patients who will develop complications and serious complications from these diseases. Certainly I know that from day one in medical school, I've had my own flu vaccination every single year. And the rationale is to protect me. Part of the rationale is for me to then protect my colleagues who I work with. But of course, part of the rationale is there to protect every single patient who I come into contact with. I think that, if we think of patients again who are not able to have, something like the flu vaccine, my cancer patients who are undergoing sort of aggressive surgery or chemotherapy, radiotherapy, it's a question of saying that their body, their immune system is busy, sort of dealing with the aggressive treatments. So actually, it's better that, where they are not able to have the vaccination, it's important that we try and make sure that everyone surrounding them is vaccinated. So even carers, even if they're not normally eligible for a flu vaccination, if they make themselves known to their GP practice as a carer, then certainly I know that the practice should identify you as such and highlight the importance of getting you vaccinated on the NHS for free.
Great, thank you. I know in your presentation you touched on the HPV vaccine. I just wondered if we could explore it in a little bit more detail, because when it came out, I think it was slightly controversial. Parents weren't sure whether to actually, consent to their children having it. And now, obviously, now it's been extended to boys and girls. Would you mind just perhaps explaining it in a bit more detail?
I mean, I think that, as I say, I mean, I did actually say that HPV was one of my favorite of the vaccinations, only because of its potential, potentially being able to wipe out the vast majority of cases of cervical cancer. But actually, it is a question of the reason why it was spread to boys as well is because actually it's not only cervical cancer that it's good at protecting against. There are a range of other cancers that it is good at protecting against, and they include things like other genital related cancers, anorectal cancers, mouth and throat cancers as well. And I think that it's a question of saying that the vaccine, it is said that most people at some point may pick up a HPV vaccination. And for the majority of people, their body may be able to sort of get rid of it naturally without treatment. However, for some people infected, with a high risk type of HPV, they may not be able to clear it. And eventually in time, it develops. It's almost, if we think of smoking as, triggering lung cancer, HPV is the virus that is carcinogenic. It is cancer causing. And therefore being able to protect yourself, from it, could prevent yourself from developing this cancer. And I guess the HPV vaccine really sort of works, before girls or boys sort of come into contact with it. So it's important to make sure that they are protected, from a younger age, which is the rationale behind, the age at which it's given, and why it's also, it's not only, it started out as a vaccination program for girls, but it is something that is being spread to boys as well.
Thank you. Is there like a catch-up program? Because some people may be delayed or perhaps chose not to have it.
I mean, certainly if you're eligible for it, you can have the HPV vaccine, on the NHS for free up until your 25th birthday. So I would say, you can go and contact, either if you're still in school, then, go and speak with the school nurse, but otherwise you can approach your GP practice and they should be able to get that organised.
Perfect, thank you. We've had a question come in about cover for tetanus in the UK and India. Could you tell us a little bit more about the tetanus vaccine?
Oh, it's a very good question. I mean, you may need to support me on this one. I mean, what I will say is that certainly when it comes to, we look, whenever we're looking through sort of travel vaccinations, then we always start with making sure that the primary vaccinations are covered. If they are already part of the primary vaccinations, then we'd say that those ones are covered, and we look at the more, usually we're traveling to exotic places, so we look at the conditions that may be affecting those particular areas. What I would say is that, boosters for tetanus, they're more likely to come about if we have sort of injuries to ourselves, especially if we have sort of dirty wounds, dirty injuries, sometimes in the garden or in unusual places. If we have a wound which is looking dirty, then I would say that if there is any doubt over the tetanus status of a patient, it is safer just to vaccinate them there and then, as well as cleaning up their wound and giving them antibiotics to protect them from further infection. It's safer to just give them a booster there and then. I would say, probably relevant to my day-to-day practice, that's what I would say in answer to that. I don't know if there's anything else that you could think of to add to that, but for me, that's the sort of core of what I would do, sort of practically speaking, about the tetanus jab.
Yeah, no, I'd agree. I think sometimes there's a booster around about 10 years, but again, like you mentioned, soil exposure, or if there's, someone who's had that kind of exposure, tetanus often can be debilitating, so they may need a booster. Yeah, I think that's a great answer. And on the same note, I think someone's also asked about other boosters like hepatitis. Again, do you know how long somebody would have to wait to have a booster for one of those?
So I think it really does vary from jab to jab, and it was interesting because when we had the opportunity to have our sort of COVID immunity tested for, I actually took the opportunity to check my sort of hepatitis B sort of status, and that's the primary immunizations that I had for those, the set of 3. That's something that I had before joining medical school back in 2003, and I could still see that my sort of Hep B antibodies were still alive and kicking, and didn't really need any boosters. So I wouldn't be able to give a firm answer on that, if I'm really honest with you. I just know that some patients, for some patients, they lose immunity quicker, whereas for other patients, they can hang on to it for longer. So I wouldn't be able to give you a firm answer on that.
That's okay. I think it's also dependent on when somebody may have had their last one. Obviously, if they're traveling or if they're going to a country where it's an endemic, then maybe they would potentially need a booster too. We've had more of a statement. I'm not sure if you'd be able to perhaps, expand on this, but someone's written in 1976, vaccine inventor Jonas Salk admitted to Congress that the live polio vaccine was the principal, if not sole cause of all reported polio cases in the US since 1961. Have you got any thoughts on that?
I mean, I think in my general reading, surrounding sort of vaccinations and hurt and harm that can come from vaccinations, I think I did come across this particular incident. Now, I did read over this, but I think the details of the case related to the purity of the vaccination that was given, and was more to do with a failure in the manufacturing of the vaccine itself. That actually there were some live cases that were triggered as a result of it. I think that if we were to sort of look at the story of polio, I did mention that polio was one of my sort of favorite vaccines as well, because it is one of the other diseases that, if we really had a genuine sort of push towards, it may be condition number 2 following smallpox, that we may be able to sort of eradicate. And I think it was a few years ago where there was only a few places in the world, sort of Afghanistan and sort of parts of Nigeria, and there was this desperate sort of heart sink moment where we were having a general sort of concern about vaccination hesitancy, where there were concerns that we could start seeing, just as we're seeing measles in this country, that we could start seeing sort of polio sort of break out in different places. So, I would say that is, I think that when it comes to, medicine and healthcare, I would be really frank that, Western medicine doesn't always get it right. I think that anybody who has seen or read up about things like the thalidomide sort of crisis, we were sort of taught about it in medical school. Just as today we're talking about the success of the smallpox vaccination program and how that's an incredible thing, we discuss our failures as well. And I think that, sort of failures in the research process, failures in the sort of manufacturing process, actually from every failure we sit down, we analyze, we look and we learn, and we look to try and make those things as robust as possible. So the research today is far more robust than where it was 20 years ago, 30 years ago. Manufacturing processes are scrutinized. I think if we have a look at, I'm giving an example related to the COVID vaccination, though I know that today's talk is not related to that. But part of the reason why there was a shortfall in AstraZeneca vaccine going through to the Europeans was because actually they just weren't passing quality control. And there were issues and problems with the manufacturer that they just said, well, it's safer to just destroy that and start again than it is to put out any kind of product that we think that may be substandard. So I think that there is a lot, I will still say, that, those are the mistakes of history. I can't sit here and say that mistakes won't happen again, but certainly I think that, there are multiple safeguards which are in place today. to ensure the safety of research, to ensure the safety of manufacture, of quality control, that we didn't have before. But we're always looking, to learn, as I say, both from our mistakes and failures, but as well as, from our successes as well.
I suppose on the same note, there was quite another controversial publication in The Lancet, perhaps in the 90s, which has been completely discredited now, about a link between MMR and autism. I just wondered if you could perhaps just clarify that as well.
So I mean, I think that there was, it's the name of a physician who is sort of famous for all the wrong reasons. So there's Dr. Andrew Wakefield, in 1998 published a paper in The Lancet sort of talking about this potential observation of autistic sort of symptoms in children who had been vaccinated with the MMR vaccine. It was stated in the article itself that a direct relationship between the two couldn't be made. I mean, the number is very, very small in terms of the number of children who are studied. But also, I think subsequently what happened was that Andrew Wakefield went on to try and, sort of subtly sort of imply that there was a link. And this was sort of picked up and blown by the media at the time. And, vaccination rates with MMR started to fall significantly. And I think that there were multiple concerns at the time. I think that things that didn't seem to quite add up was that, he himself had a patent for a single antigen measles vaccine in 1997. And one of the things he was saying was that we should give single vaccines instead of this joint vaccine. So it's a question if he would have sort of financially benefited from it if that was something that would move forwards. And I think that, actually it became apparent that he was being funded by sort of attorneys and things who are filing lawsuits against vaccine manufacturers. And I think over the decades since, there have been multiple, not looking at ones and tens of cases, but multiple large population studies really looking to try and see, forensically look and see, is there genuinely any link between these things? And very, very systematically, they've been sort of disproved again and again, to the point where in 2010, the Lancet, sort of formally retracted the paper. And I think very soon afterwards, the General Medical Council fully revoked sort of Andrew Wakefield's license to practice. So, I think it was, it's been fully sort of discredited. And I think that, more harm than good sort of came as a result of that. And we still feel the sort of reverberations from those unfortunate incidents back then.
Thank you for clarifying that. And I think that's really clear that there is definitely no link between the two. I think that we're almost actually done with questions. There's one more that is, if I choose not to have the vaccine, so for example, something like the flu vaccine, will I automatically be immune because everybody else has had the flu vaccine around me?
So, I mean, I think what I would say is that this is sort of feeds into the situation that we find ourselves in. I think, I said earlier on in the presentation, many of the diseases, I describe them as, sort of horror stories, like fairy tales that I've read about and studied at medical school, but never actually seen sort of real cases of. And I think that sort of comes down to, this concept of herd immunity, that actually if there are enough people in the general population who are vaccinated, then actually if one of these diseases tries to spread itself like fire, then actually it just stops dead when it sort of hits somebody who's vaccinated. But herd immunity only works when we're able to build that, and we're able to build enough immunity in the population. So I think that part of the worry and fear that I have at the moment with general vaccine hesitancy is that parents will come confidently and correctly tell me that my first child's not vaccinated, my second child's not vaccinated, I'm not going to get my third child vaccinated because my first two are completely fine. And I guess part of the concern is that as vaccination rates drop, we lose the protection of herd immunity. and actually that there could be outbreaks. And I think that, sort of at the moment, herd immunity very much is there to try and protect, as I was describing, patients who cannot have, not because they have a choice, but because they cannot have the vaccinations. So just as much as we think of adults undergoing, sort of chemotherapy, radiotherapy, I had the privilege of supporting, when I did pediatrics, young children with leukemia who were going through really aggressive treatments. And it's a question of saying, well, they don't have a choice about this. Then they need to be protected, and they are protected by the herd, having that herd immunity. So I would say that it's a dangerous tightrope that we're walking at the moment. That at the moment, those who are not vaccinated may be protected by the herd, but that herd immunity will, is there a risk of it being lost as time goes on? Is the question and the reason for sort of talking about it in open terms like today.
Perfect, thank you. And thank you for letting me interrogate you. Sorry, I know that wasn't easy. A million and one questions. So yeah, thank you so much. It's really insightful. Did you have any sort of closing comments before we sign off?
I mean, really what I wanted to say was, I wanted to give my profound thanks and gratitude to our beloved Bhagavan, as well as to the Sai Health Committee for giving me the opportunity to look into and talk about this. I think that when I started this as an idea to talk about, I don't think that I really sort of understood or appreciated how incredible an achievement it was. That, like I say, us as a human family were able to, put aside all sorts of issues and problems, and we were able to come together, and we were able to, eradicate and defeat this nasty disease. And I think it really is an incredible story of hope. And I think that, those lessons we should learn and move forwards with. But it was really, really fascinating and really enjoyable to look and read and research, everything that went into this. And it was a story that made me, I'm a healthcare professional, but we stand on the shoulders of giants that came before us, and we learn, from the incredible things that they did before us as well. And just as much as there is fear, worry, and anxiety about things, I think that we should spend time celebrating things as well. And I think this is certainly one of those things. Thank you.
Amazing. Thank you. And thank you to our media team for Seshan for organising this, and Gayatri Aunty and Dr. Badia for your continued support. Our next webinar is on the 2nd of November, and it's entitled Reconnect to Your Wellbeing. So we look forward to seeing you then. Saram,
Thank you.